Good day, dear students. Welcome back with the second part of the medical terminology lecture. I'm Dr. Nirmeen Ataya, Professor of Forensic Medicine and Toxicology. The objectives of our lecture today. By the end of this lecture, you will be able to define what is the meaning of prefixes and suffixes, identify the rules for using prefixes and suffixes, and then apply the rules of building medical terminology. For the content of our lecture today, there exist three main items. We are going to have a quick review for the previous lecture, and then we are going to talk about affixing, which is the use of prefixes and suffixes, and then how we are going to construct our medical terminologies, or what are the different types of constructions present for medical terminology. Before we start, I have to remind you with our session etiquette, or the etiquette and ground rules required for our online session. Please place yourself in a quiet place without any disturbing noises. Take notes while watching the lecture. And please go over your lecture on the same day and do not postpone or procrastinate the work of today. We have covered in the previous lecture and one of the main items, which is called word elements. And we have known that there exist three basic components or three basic word elements. There exist the root, prefixes, and suffixes. And as a general rule, the root we have got, before we describe the general rule for the root, I have to remind you that the root is the foundation for the medical terminology. And we have got two types of roots. The Greek root, which is used to build words that describe the disease, condition, treatment, or diagnosis, and the Latin roots, which are used to build words that describe anatomical structures. And we have had some examples for the common word roots, whether in the Greek form, either in the Greek form or in the Latin form. For the examples of the word root, for the brain, I have chosen for you the English term brain. The Greek root or the Greek form of the root is called encephal, and the Latin root form is called cerebr. The medical terminology derived from the Greek form I have chosen to tell you is the encephalopathy, or a disease which affects the brain, a term that describes a brain disease, encephalopathy. Pathy denotes a disease, and encephal is the Greek form of the brain of the root. And then for the Latin root, I have chosen an example for the medical terminology, which is called cerebral hemorrhage. And it is a term that describes bleeding pertaining to the brain. The second item in the previous lecture, we have talked about combining forms. And the combining form, it is the word root combined with a vowel. And we usually use the O vowel, but occasionally we can use the I vowel. The first rule regarding the combining forms is when we use more than one root in our medical term. The example I have selected or presented to you is the term cardiomyopathy. And as you remember, it is a pathology in the cardiac muscle. If we analyze this term, we can find that the first root is cardi and the second root is my. The first root is cardi, which represents the heart, And the second root is my, which means muscle. And as the second root starts with a consonant, I have to use a combining vowel. The last part of the term is called pathy or disease. And this suffix starts also with a consonant, so I have to use a vowel, the combining vowel. And that's why I have finally the term cardiomyopathy or disease in the cardiac muscle. The second rule is regarding the end of the medical term. I cannot end my medical term with a combining form. I cannot end my medical term with a root. I have to end my medical term with a suffix. So, a suffix has to be added at the end of the word. A combining vowel will be used if the suffix begins with a consonant, and the combining vowel is generally not used if the suffix begins with a vowel. And here I have an example of a condition called megalocardia. Megal means enlarged. Cardia, of course, means the heart. And then I have to add the vowel O, the combining vowel O, because card or cardi is or starts with a consonant. And I have to end with the suffix A because I cannot end my term with a root. And finally, I have the term or the medical term megalocardia, or a condition in which there is an enlargement of the heart. Now we are going to start our new topic today, which is the affixing, or the use of prefixes and suffixes. Have you ever drawn a diagram? Have you ever taken a pretest? Have you ever been described by an antibiotic? Have you ever received a blood transfusion? Have you ever thought about the many prefixes we use on the daily basis? From these terms, we can observe that there is dia before the word gram, pre before the word test, anti before the word biotics, and trans before the word element fusion. We can conclude that a prefix is a word element added at the beginning of the word. A prefix is a word element added at the beginning of the word. And of course, to give different meaning of the word. As we can remember the word port in the last lecture, and we have added several prefixes that changed the meaning of the word. I have got an important rule regarding prefix. The meaning of a prefix will not change from word to word. Again, the meaning of a prefix will not change from word to word. This means that the meaning of a prefix is fixed. The meaning of a prefix is fixed. For an example, I have a prefix called tachy, and tachy always means rapid or fast. For example, when I add this prefix to cardia, I have tachycardia, which means rapid heart rate. And when I use the same prefix tachy with the word element pnia, it means rapid breathing. Now I have used the same prefix but with different roots, and it gave me different meanings for the whole term. But still, tachy means rapid in both terms. However, words with the same root will have different meanings depending on the prefix attached. It means that if I add different prefixes to the same root, I will have different meanings. Let's see this table and see the examples presented in this table. I have the root pni, means breathing, and I have added the prefix des. And I found out that, or it concluded, or it finally resulted in a word which is called dyspnea. Dyspnea means difficult breathing, because the prefix des means difficult. In this example, I have to notice two items. The first thing that I have used the suffix a because I cannot end my word with a root, so I have to end my word with a suffix. The second thing I want you to notice is that there is an exception in using a combining vowel. Although the root I have used starts with a P or a consonant, I did not use a combining vowel. I directly attached the root to the prefix. And this is one of the exception cases for our rules of using combining vowels. Returning back to the prefix. Again, example I have is using the word dyspnea. Dyspnea is formed of two items or two elements. It's formed of three elements. The first is the prefix, which is des, it means difficult, and the root pnia means breathing, and a suffix ending, which is a. And finally, I have the term dyspnea, which means difficult breathing. I have used the same root with different prefixes, and I have got different words with different definitions. Prefixes are attached to words to express numbers. For example, di, tri, quadri, these are prefixes. Measurements, positions and directions, negatives and colors. These are the occasions where I have to use a prefix. I have added several slides with the most common used prefixes for you to study, and they have been attached to this presentation. Now we are going to talk about suffixes. Suffixes are placed by the end of the word. They make the word either a noun or an adjective. And they indicate surgical procedures, types of surgeries and specialties, specialists and conditions. And all of these indications are either noun or an adjective. Again, a suffix is placed by the end of the word to make this word either a noun or an adjective. In the previous rule, I mentioned the suffix that starts with a consonant. In this rule, how we are going to deal with the suffix which starts with a vowel. In this condition, I can attach directly the suffix to the word root without the need of a combining vowel. The example here for the term or the word gastralgia. Algia also means pain. And this suffix algia starts with an a vowel. I can attach directly this suffix to the word root gaster, which means stomach, to finally have a word which is called gastralgia, which means pain in the stomach. Okay, for rule 1 and rule 2, it means that if the suffix starts with a consonant, I have to use a combining vowel. If the suffix starts with a vowel, there is no need to use a combining vowel. Do you remember the rule that is related to the prefixes? It is applied here also for the suffixes. The meaning of a particular suffix does not change from word to word. as to say the meaning of a particular suffix is fixed. A word with the same root does change in its meaning by using different suffixes. As I have previously used different prefixes with the same word root and have different definitions in different words, the same rule applies with suffixes. I can have the same word root and attach different suffixes to the same word root to have different words and different definitions. Let's apply this rule. We have discussed the word gastralgia or pain in the stomach by adding the suffix algia, which means pain, to the word root gaster. Another example or another word uses the same word root, which is gaster or stomach, and I have used a different suffix which is itis, means inflammation. So I have the word gastritis, which means inflammation of the stomach. Another example using the suffix ic, which is with the same word root, and I have the word gastric, which means something pertaining to the stomach. For example, gastric ulcer, gastric content, gastric acid. It means that the ulcer, the acid, the content are all pertain to the stomach or are all related to the stomach. Here, gastric is an adjective. Gastralgia, gastritis are nouns. For the last example is called gastrostomy. I have used the suffix ostomy, which means creating a new opening. So, gastrostomy means creating a new opening into the stomach. I have used the same word root with different suffixes. I had different words with different definitions. As I have mentioned before, that suffixes are used to express nouns. We have got different rules regarding the change from the singular form to the plural form of nouns. These rules depend on the ending of the word. Again, these rules depend on the ending letters of the singular form. Let's present our rules. For example, when the singular form of the word ends with an A, as in case of the word pleura. And for your information, pleura is the outer covering of the lungs. When I want to change the singular form to the plural form, I have to change the A into AE and pronounce it in such way. Pluri. Pleura in the singular form becomes pluri in the plural form. When the singular form of a word is in an AX, as in case of thorax, thorax changed the AX to become ACES, and I have to say or pronounce it thoraces. Thorax in singular form becomes thoraces in the plural form. I have replaced the AX into ACES. The level of, for example, a pyramid, the highest point is called an apex, becomes apices. The same rule as an IX, I have replaced the EX with ICES. The next rule is when the word ends with an ON, as in case of a ganglion. The plural form becomes ganglia. I have replaced the ON with IA. and it became ganglia. The next rule is when the singular form ends with a um, as in case of bacterium, one single bacterium. To make it plural, I remove the and replace it with ia. It became bacteria. The next example, the next rule is when the singular form ends with a us, as in case of a thrombus. I remove the us and replace it with an I. The thrombus, which is in the singular form, becomes thrombi in the plural form. Another example for a word ending with a us is a bronchus. A bronchus is a tube present, a type of tube present in the respiratory tracts. The plural form of a bronchus is bronchi. The last rule is when talking or the word ends with a ma, as in fibroma. The plural form ends with mata, fibromata. So these are the rules when I want to change one word from a singular form to one word to another, to the plural form. I have to look at the ending letters of this word, whether an A to convert it to AE in the plural form, AX converted to ACES in the plural form, ice to C's, IX and EX change into ICES, ganglion, ON ends replaced by A, is replaced by IA, US is replaced by I, and ma is replaced by mata. Also, I have attached several slides containing the most commonly used suffixes that you have to study them. Now we came to the last item of our lecture today, is constructing medical terminology. What are the different constructions for medical terminology? The third type of construction is prefix and a root. And here I have stated the example I have mentioned before is the term dyspnea, or difficulty in breathing. Dyspnea means breathing, the root breathing, and des means difficult. The fourth construction is formed of root and suffix. The example I have chosen to use is called cystitis. Itis means inflammation. Cyst means the urinary bladder, the place that collects the urine. So, cystitis means inflammation of the urinary bladder. The last type of construction is formed of a prefix and a suffix. The example I have chosen to you is a term called hyperemia. Hyper means increased. Emia means blood flow or circulation. So hyperemia means increased circulation or blood flow. When I want to define a medical term, any medical term, as we have observed, it forms of two or more parts. With which part I'm going to start with? Am I going to start with a root? Am I going to start with a suffix? Am I going to start with a prefix? So our rule is we have to state the definition of any medical term starting with the suffix. What is my case? My case is inflammation. My case is in breathing. My case sorry, my case is difficulty. My case is in the constructions of suffixes. Inflammation, blood or circulation. Where is my condition? Am I talking on which condition? I am talking here on inflammation. I'm talking here on circulation. So in the constructions started or constructions starting with suffix, I have to start with the suffix. In the constructions having suffix, prefix, and root, I have to start with the suffix followed by prefix. And finally the root. For example, in case of the first construction, pericarditis, inflammation of the surrounding of the heart. Inflammation of the surrounding of the heart. For the second construction, which is formed of root and suffix, also I have to start with the suffix. Osteomyelitis, inflammation of the bone and bone marrow. Here, for the construction with the root and suffix, cystitis, inflammation of the of the urinary bladder. In cases of prefixes, I have to start with the prefix and finally the root. And finally the root. The last thing is the root. Dyspnea, difficulty in breathing. By the end of our lecture, now we have known what's meaning of affixing by adding prefixes and suffixes and the rules guiding the use of these prefixes and suffixes. And don't you ever forget that I'm going to attach to you a list of the most commonly used prefixes and another list for the most commonly used suffixes that you have to study them by your heart. And then we have known the construction or the different types of construction for medical terminology. Which one is formed of only root and suffix, root and prefix, or prefix and root, and which terms are constructed by using the three elements. I thank you very much for your time, and you are totally free to ask me anything by our formal channels through the Microsoft Teams, and don't you ever hesitate and ask me or contact me for any question you need to ask about. Good luck and nice talking and nice lecturing you in this topic. Mm.